Good morning. My name is Amanda Butch. I'm a part of Capella University. Today I'll be presenting a health promotion plan for the Latino community in the San Fernando Valley. This plan is going to focus on reducing health disparities, improving access to care, and promoting physical and mental well-being through multiple cultural responsive strategies grounded in public health principles and Healthy People 2030 objectives. Where we will begin is speaking on the Latino community in the San Fernando Valley, particularly. The Latino community makes up roughly 43% of the San Fernando Valley's 1.8 million residents. Many households are multi-generational, with 3 or more family members living under one roof. The median household income is about $90,000. However, per capita income averages only about $46,000. So there is a whopping disparity that is obviously seen, especially with larger family sizes. Education levels are improving. However, access to higher education remains limited, and many residents work in essential sectors such as construction, healthcare, food service, and manufacturing. Along with that, long commutes are very, very common, with many of the Latino community spending a large amount of time on the road getting to and from their place of work to their homes. Further, the major health disparities that we see are definitely mental health, with 27.5% of teens reporting unmet emotional needs. Chronic disease is about 24.2% of Latino community youth who are seen as hitting obesity ranges. Access to healthcare is rough, with 30% with a lack of actual general practitioner. And there are insurance barriers, with a large majority of the Latino community not having insurance. We see that several health disparities, as stated before, are obesity in children and adults. We see later in life that type 2 diabetes, hypertension, and cardiovascular disease are incredibly common with the adult population. As stated before, 30% of Latino Californians actually report having a primary care provider. So many of the community use the emergency department as a form of primary care. So access to care does remain a large barrier to healthcare for the community. Together, mental health and limited access to a primary care physician leads to many untreated conditions and long-term inequities. Moving on into a community needs assessment, we do see that their needs need to be met physically, emotionally, and socially. Families express that there is a need for bilingual health care. We see that there is a barrier to properly conveying messages when there is a healthcare visit, because there is no opportunity for a bilingual translation. We do see in emergency departments that they are using translators more often. We see that many adolescents actually lack safe spaces for exercise and struggle to balance school, work, and home responsibilities. Many adolescents actually carry a job while also going to school, causing strain on the adolescent to perform well, because there is the balance of having responsibility to the family home and contributing to the monetary value towards groceries and providing for the family, while also trying to pass classes. Economic instability and transportation barriers limit access to preventive services like getting to and from general practitioner appointments. However, by addressing these needs through community-centered programs, we can improve both individual and family health incomes. As we stated, many households do have multiple family members of multi-generational ages living under one roof. So the framework for the health promotion plan in the San Fernando Valley is going to be a social ecological model, which shows how health behaviors are influenced by multiple levels, from the individual to the family to the community, and overall developing a public policy. This creates a well-rounded community-based health intervention that will benefit the Latino community as a whole. At the individual level, focusing on education and skill building are essential for the individual person to succeed. At the interpersonal level, family, friends, social networks, creating a strong support system reinforces healthy choices. If everyone is on board, then more than likely the individual is able to succeed. Community and organizational partnerships like clinics, schools, and faith-based groups create long-term sustainable care for the individual. If they're a part of a group that is doing positive things, then they themselves will be a more positive person. And at the policy level, we have to ensure that there's advocacy towards equitable funding and coverage for Latino youth and families. So our health promotion goals are SMART goals, which are specific, measurable, achievable, relevant, time-bound goals, focus on reducing obesity in the Latino adolescents by 10% in approximately 3 years, increasing mental health access by 15% in 4 years, and goal 3, to increase participation in nutrition and physical activity programs by 20% in 2 years. And in terms of healthcare, raise the number of Latino adolescents with a primary care physician, which is a huge feat to provide proper health care that follows the adolescent from childhood into adulthood, creating hopefully a more positive health outcome overall for the individual. Some intervention strategies are creating bilingual health fairs, offering screenings and preventative education, offering vaccinations at healthcare fairs, creating school-based wellness and mental health programs, which is a huge one to start early on in life and to get ahead of the curve and actually create a better environment for students within the school that they can actually bring home to their family. Train community healthcare workers that are bilingual, can do outreach to neighborhoods that are possibly impoverished or lower equity, and doing things such as faith-based partnerships, which actually helps promote trust and participation overall with the adolescent. So the way that you can really get through to the Latino population is to, first of all, start in a bilingual premise, to have materials that are English and Spanish, to reach out to social media, radio, channels like Univision, Telemundo, and local Spanish radio stations actually helps reach out to the community more. Schools and churches will also serve as community information hubs, and this keeps the communication culturally grounded and has a higher chance of actually getting to the Latino culture. One partnership and resource that we can actually draw upon is, first of all, the CDC. They actually will give technical guidance and funding support. Partnering with the Los Angeles County Department of Public Health to provide data and logistics, and FEMA and CDC only helps to further uplift the Latino community. Local clinics and qualified healthcare centers will provide bilingual care. It all starts with understanding and providing resources in Spanish. Doing all of these ensures that the plan is both sustainable and equitable for the population. Obviously, in order to make sure that an impact is being made, you have to be able to evaluate and measure. So, seeing that the success of the program is actually happening, you have to use surveys, attendance data, health outcomes, which can be tracked by the community clinics and schools. Tools like CDD's Casper assessment and the CIRC framework will help measure communication effectiveness and community engagement. And just overall having metrics, including preventative care visits at actual primary care physician offices, seeing that obesity rates are improving, and seeing that there's overall more wellness being promoted among adolescents. The overall plan and to keep progress going is to train local community healthcare workers to outreach this community. Partnerships with schools to keep the programs at the forefront, since they spend majority of their time in school, 8 hours out of the day, will ensure that programs are actually working. And then getting funding from CDC, as stated before, will support services sustainability long term. Again, expected outcomes are, measured through SMART goals. We hope to see measurable improvements in physical health, mental well-being, and overall wellness for the individual as a whole. Obesity rates will lessen, chronic disease management will lessen, and we will actually see better preventative health services. Overall, the goal is to make sure that the Latino community, and specifically adolescents, are attended to, and to face these disparities head on, and to make a change as a whole and impact the population in a positive manner. Thank you so much for your time. I greatly appreciate you listening in. Here are my references, and have a great day.